Good day, everyone. It's your another reporter, Vincent Harold D. Cabanigan. In this whole discussion, I am going to talk about the poliomyelitis and the rabies human. So, after I discuss um, about the poliomyelitis, I am expecting everyone to describe the epidemiology of poliomyelitis and its transmission. And then everyone knows the treatment and diagnosis that is infected by the virus. Um, let's start. So poliomyelitis, also called as polio, as everyone known for it. It is a disabling and life-threatening disease caused by the polio virus. Polio is first known to have occurred nearly 6,000 years ago, as evidenced by the withered and deformed limbs of the certain Egyptian mummies. Poliomyelitis is a highly infectious viral disease which mostly affects young children. The virus spreads from person to person and can infect a person's spinal cord, causing paralysis. So, the word poliomyelitis originates from the Greek word polio, meaning gray, and myelon, meaning spinal cord or marrow. It is an infectious disease, a member of the genus Enterovirus, belonging to the Picornaviridae family. Patient's care. How is polio treated? As everyone knows, there is no cure for polio. Only treatments to manage the symptoms. Mild cases usually are treated with plenty of fluids and bed rest. Someone who has a muscle pain or weaknesses will get medicine to treat the pain, and physical therapy to keep the muscles moving. So the treatment of poliomyelitis is mainly supportive. It can be done physically therapy, total hip arthroplasty. It is only selective, those only who needed it, and diet. So in physical therapy is indicated in cases of paralytic disease. So in paralytic disease, it provides frequent mobilization to avoid the development of the chronic decubitus ulcerations. Active and passive motion exercises are indicated during the convalescent stage, meaning it is a gradual recovery. So in total hip arthroplasty, it is a surgical therapeutic option for patients with paralytic sequelae of poliomyelitis who develop hip dysplasia and degenerative disease. The last one is diet. Because patients with poliomyelitis are prone to develop constipation, a diet rich in fiber is usually indicated. But all in all, maintaining high levels of polio immunization in the community is the single most effective preventive measure. So, poliomyelitis or polio is a disease caused by the polio virus. It is the causative agent of polio and is a serotype of the species Enterovirus C. It often spreads due to contact with infected feces. This often happens from poor hand washing. It can also happen from eating or drinking contaminated food or water. Reservoir mode of transmission. Okay. So humans are the only reservoir of poliovirus, which is transmitted most frequently by persons with inapparent infections. There is no asymptomatic carrier state except in immunocompromised persons. Person-to-person spread of poliovirus occurs via the fecal-oral or the oral-to-oral routes. Polio is spread when the stool of an infected person is introduced into the mouth of another person through contaminated water or food. That is what we call fecal-to-oral transmission. Oral-to-oral transmission by way of an infected person's saliva may account for some cases. Now let's move on to the laboratory diagnosis. So poliovirus can be detected in specimens from the throat, feces, and occasionally cerebrospinal fluid, or what we call CSF for short. By isolating the virus in cell culture, or by detecting the virus by the PCR or the polymerase chain reaction. Most laboratories conduct testing for poliovirus, including culturing, intratypic differentiation, genome sequencing, and serology. They also do analysis. For the virus isolation and detection, virus isolation in culture is the most sensitive method to diagnose poliovirus infection. Poliovirus is most likely to be isolated from stool specimens. It may also be isolated from pharyngeal swabs. Isolation is less likely from the blood or the CSF. CSF is made by the tissue that lines the ventricles. So, to increase the probability of isolating the poliovirus, they need to collect at least 2 stool specimens 24 hours apart from patients with suspected polio. These should be collected as early in the course of disease as possible, ideally within 14 days after the onset. So, real-time reverse transcription PCR is used to differentiate possible wide strains from vaccine-like strains, or what we call the intratypic differentiation. So, using virus isolated in culture as the starting material. Partial genome sequencing is used to confirm the poliovirus genotype and determine its likely geographic origin. So, in serologic testing, it may be helpful in supporting the diagnosis of paralytic polio, particularly if a patient is known or suspected to not be vaccinated. And lastly is the cerebrospinal fluid analysis. So, detection of the poliovirus in CSF, or analyzing the virus using CSF, is uncommon. So, a CSF analysis is a group of tests that look at your CSF to help diagnose diseases and conditions that affect the brain and the spinal cord. Though it is not rare for us to hear the word polio, but it is better to prevent it as much as we can. Now let's move on to the rabies human. Our objective in this topic is to describe the epidemiology of rabies virus and its transmission. The second one is to discuss the treatment and diagnosis that is infected by the virus. So, what is rabies? Rabies is a deadly virus spread to people from the saliva of infected animals. Unlike the polio virus, though rabies is deadly, it is a preventable viral disease. Rabies is a viral zoonotic disease that causes progressive and fatal inflammation of the brain and spinal cord. Rabies is estimated to cause 59,000 human deaths annually in over 150 countries, with 95% of cases occurring in Africa and Asia. 99% of the death caused by this virus came from the dogs. The name rabies is derived from the Latin rabies, means madness. This in turn may be related to the Sanskrit rabhas, meaning to rage. The Greeks derived the word lysa from loud or violent. This root is used in the genus name of the rabies virus, Lysavirus. Once a rabies infection is established, there's no effective treatment. Okay, so though a small number of people have survived rabies, the disease usually causes death. For that reason, if you think you have been exposed to rabies, you must get a series of shots to prevent the infection from taking hold. If you have been bitten by an animal that is known to have rabies, you'll receive a series of shots to prevent the rabies virus from infecting you. If the animal that bite you can't be found, it may be safest to assume that the animal has rabies. But this will depend on several factors, such as the type of animal and the situation. in which the bite occurred. The rabies shots include a fast shot and a series of rabies vaccination. So a fast-acting shot is to prevent the virus from infecting you. This is given if you haven't had the rabies vaccine. This injection is given near the area where the animal bite you. If possible, as soon as possible after the bite. The next one is a series of rabies vaccination. It is to help your body learn to identify and fight the rabies virus. Rabies vaccination are given as injection in your arm if you haven't previously had the rabies vaccines. You will receive 4 injection over 14 days. If you had the rabies vaccine, you will have 2 injections over the first 3 days. Pathogenic microorganisms. So the causative agent of rabies is rabies virus. It is a negative stranded RNA virus of the rhabdovirus family. So rabies virus, scientific name rabies lysovirus, is a neurotropic virus that causes rabies in humans and animals. Neuroinvasiveness and neurotropism are the main features that define the pathogenesis of the rabies. As we all know, rabies is most common in countries where stray dogs are present in large numbers. The most common wild reservoirs of rabies are raccoons, skunks, bats, and foxes. So domestic mammals can also get rabies. Cats, cattle, and dogs are the most frequently reported rabid domestic animals. So rabies can develop if a person receives a bite from an infected animal, or if saliva from an infected animal gets into an open wound or through a mucous membrane, such as the eyes or the mouth. It cannot pass through unbroken skin. Um, Rabies transmission can occur through the saliva of animals and less commonly through contact with human saliva. Laboratory diagnosis. At the time of a bite, there is usually no way to tell for sure whether an animal is rabid or whether it has passed on an infection. Lab tests may show antibodies, but these may not appear until later in the development of the diseases. The virus may be isolated from saliva or through a skin biopsy. However, by the time a diagnosis is confirmed, it may be too late to take action. For this reason, the patient will normally start a course of prophylactic treatment at once without waiting for a confirmed diagnosis. If a person develops symptoms of viral encephalitis following an animal bite, they should be treated as if they have rabies. So for the diagnosis in animals, a diagnosis of rabies can be made after detection of rabies virus from any part of the affected brain. But in order to rule out rabies, the test must include tissue from at least 2 locations in the brain, preferably the brainstem and the cerebellum. The test requires that the animal be euthanized. The test itself takes about 2 hours, but it takes time to remove the brain samples from animals suspected of having a rabies and to ship these samples to a state public health or veterinary diagnostic laboratory for diagnosis. So based on the routine public health surveillance and pathogenesis studies, we observed that it is not necessary to euthanize and test all animals that bite or otherwise potentially expose a person to rabies. For animals with a low probability of rabies, such as dogs, cats, and ferrets, observation period 16 days may be appropriate to rule out the risk of potential human rabies exposure. So, a consultation with the local or state health official following a potential exposure can help that determine the best course of action based on current public health recommendations. So, for the diagnosis in humans, several tests are necessary to diagnose rabies ante-mortem or the before death in humans. So, no single test is sufficient. Tests are performed on samples of saliva, serum, spinal fluid, and skin biopsies of hair follicles at the nape of the neck. Saliva can be tested by virus isolation or the reverse transcription, followed by the RT-PCR or the polymerase chain reaction. Serum and spinal fluid are tested for antibodies to rabies virus. Skin biopsy specimen are examined for rabies antigen in the cutaneous nerves at the base of the hair follicles. So let's end this discussion with a quote from Neil deGrasse Tyson. Ignorance is a virus. Once it starts spreading, it can only be cured by reason. For the sake of humanity, we must be that cure. Thank you, everyone. Again, I am Vincent Harold Digabanigan, your reporter.